Hi, this is Dr. Adelsheimer. I apologize for um, the snag. Unfortunately, I had started another meeting, which I didn't mean to do, and I went through the whole thing and just realized that that was not what we wanted to do. So I'm going to do it all over again, and hopefully this will be recorded. So if anybody did happen to miss this, they can watch a recording. But again, I'm happy to answer any questions, and hopefully people will realize that they can still log in here. And again, I do apologize for the snafu for tonight. So the title of tonight's talk is How to Avoid Surgery by Using Your Own Platelets and Stem Cells. Again, I want to introduce myself. I'm Dr. Mark Adelsheimer. I went to college at Duke University, graduated in 1987. I graduated from medical school in 1991 from the Medical College of Pennsylvania. And then I did my residency at Tufts University in Boston, where I was chief resident, finishing in 1995. I then moved to Pittsburgh in 1996, and I have been here in practice in Pittsburgh for the last 26 years. And in my spare time, I like to play a little golf. These are my two partners, Dr. Lieber in the middle and Dr. Sally on the right. We're all board certified in physical medicine and rehabilitation. We're all physicians, and we're all from the Pittsburgh area and all Pittsburgh natives. We see patients in 5 different locations. Our main office is in what we call the Pittsburgh location, which is really in Fox Chapel and RADC Park. We also have satellite offices in Monroeville, Bridgeville, Washington, and Sewickley. The procedures I'm talking about tonight, however, are done in our main Fox Chapel location. However, we can evaluate you in the other locations for consultation. First, just wanted to mention that we are a COVID-safe practice. Everyone in our practice has been immunized and boosted, and we take all COVID safety precautions. So just as a quick overview, what we're going to be talking, why you're here. So we want to how to avoid pain, avoid surgery, avoid downtime. You may have been told you're not a surgical candidate. You're looking for options. You don't want to rely on medications to deal with pain. You don't want to have to just learn to live with it. And you're not ready to slow down, and you want more from your life. So what we're really talking about isn't just avoiding pain, but it's improving the quality of your life. So whether that's going out and having some recreational activity, doing more high-level sports, or just enjoying time with children and grandchildren, how you can really improve the quality of your life. And that's what it's all about. So this is a brief overview of tonight's talk. I'm first going to talk about Regenexx. Then I'm going to talk about different options that we have. I'm going to go into what interventional orthopedics is. I'm going to talk about the differences that Regenexx can offer. I'm going to talk about some different areas of the body that we treat and some of the results that we see, and how this might be a good product for you. So Regenexx is where orthopedic stem cell injections were invented. It was founded in 2005 and was the first clinic on earth to begin treating orthopedic conditions using precise stem cell injections. Dr. Centeno and Schultz, who are also physical medicine rehabilitation physicians, started Regenexx, and in 2012, they realized that they needed to expand because they were too busy in Colorado. And we were actually one of the first Regenexx clinics outside of the state of Colorado. There's now, actually, there's up to 70 Regenexx clinics around the country. And again, we were one of the first Regenexx clinics outside of Colorado. Every Regenexx provider is an MD or DO. And they are all trained in the same way. Sorry about that. I wasn't sharing my screen appropriately. Definitely having a bad night when it comes to the technology here. So again, Regenexx is not a product, but a family of medical procedures that define what we consider a new medical specialty known as interventional orthopedics. So again, Regenexx is where these were all started. So what is the goal of interventional orthopedics? The goal is to do less invasive procedures to avoid more invasive surgeries. We want to let the body heal itself. So let's stop cutting things out and instead let's place some cells in there to help heal things. Surgical orthopedics will not be the dominant form of care in the 21st century. Most meniscus surgeries that are being done now are actually removing a much needed spacer. So there's been a lot of research in the last 5 years that shows that removing meniscus tissue, all it does is speed up the onset of arthritis. It doesn't actually solve the problem, it makes things worse. So rather than cutting things out, let's instead inject biological agents that can help heal the underlying tissues. So again, this is a little slide showing where orthopedics was in 2000, meaning that almost everything was done surgically. By 2015, that gap had been bridged a little bit, but in the future, this is what we're looking at. So approximately 75% of orthopedic problems in the future will be able to be treated non-operatively with interventional procedures. It's also important to note that Regenexx physicians are trained in how to do precision guided injections. And this is trained, and we use precision guidance with musculoskeletal ultrasound and with fluoroscopy. 50% of physicians who do injections are doing these blind, meaning that they have no training whatsoever. They're just sticking a needle, they're feeling a joint and hoping they're hitting the right spot. This is absolutely inappropriate because there's technology out there that make these injections very easy. 45% of doctors can do some low accuracy injecting, but only about 5% of physicians are actually trained in how to do accurately precision guided injections, and therefore you're actually sticking the needle in the correct location. So these are the different treatments that we have to offer. I'm not going to really talk much about prolotherapy, although that was the grandfather of regenerative medicine. The main talk today is going to be about platelet-rich plasma treatments, platelet lysate, and stem cell using bone marrow or bone marrow concentrate, where we derive your stem cells from. So first, let's talk about platelets. Platelets are the healing cells in the blood. So they're a blood cell. They're very easy to obtain. All we need to do is draw some blood, and then we spin it down and we isolate your platelets. They contain healing growth factors. They help to speed up the repair of tissues, and they also contain serotonin, which is a neurotransmitter that helps to calm down pain. In addition, platelets will help to attract stem cells to a certain area and will activate them, period. So we do two different types of platelet procedures in our practice. We do platelet-rich plasma, or PRP, also known as SCP, which stands for super concentrated platelets. And these are when we're treating more minor orthopedic problems, things like tendinitis, like rotator cuff tendinitis, Achilles tendinitis, tennis elbow, golfer's elbow. These are more minor problems that respond very well to PRP, very commonly used in the sports medicine community because a lot of the athletes have more minor injuries. Things like meniscal tears without arthritis can be treated with PRP, and you can solve that problem. Things like plantar fasciitis also responds really well with PRP. The other way we use platelets are in our nerve injections, specifically our epidural injections, or treating things like carpal tunnel syndrome. So we take those platelets and we lyse them, or we freeze them, which will have them immediately release their growth factors. And when you inject those growth factors onto nerves immediately, it helps to heal those much quicker. This is a slide showing the difference between standard PRP and Regenexx SCP, or Rprp. And as you can see, the main difference is ours doesn't have any red blood cells in it, because we have a superior product than what you will get at your orthopedic surgeon's office. Most orthopedic surgeons do PRP, however, they don't have the technology to get rid of all of the red cells. So they are injecting an inferior product into your area of problem. We're able to concentrate our PRP to 20 times over whole blood, whereas standard PRP, the best they can do is about 5 times. So again, not all PRP is the same. Regenexx PRP is a significantly superior product than you would get at an orthopedic surgeon's office. So the other thing we inject are stem cells, and we get the stem cells from bone marrow. So bone marrow concentrate, if you can concentrate bone marrow, you're able to get billions of stem cells. Stem cells are an undifferentiated cell that are held in reserve until replacement or repair is needed. It can turn into many different cell types. So the same stem cell can turn into a cell that can grow new cartilage. That same stem cell can turn into a cell that can grow new bone. That same stem cell can turn into a cell that can grow new ligament or tendon. So that's what's very exciting about using stem cells, is they can grow into multiple different cell types. And even more importantly, they orchestrate a repair response when placed into these cells. So if you take a stem cell and put it into a torn rotator cuff or into a torn ACL, you can actually grow new ACL and repair the ACL that's still there. And I do have some examples of that later on. Also, stem cells self-renew. So people say, hey, if you take out all my stem cells, what's going to happen? I'm not going to have any stem cells left. That's not true. Your stem cells are like other blood cells in that you're constantly replenishing these during your entire life, and your body will regrow all of these stem cells that are taken out within a month or two. They also provide new blood supplies into the areas where they're injected. So it's very important to understand that we're discussing autologous stem cells, meaning stem cells that come from you. These are not coming from embryonic tissue. They're not coming from amniotic fluid or cord blood. These are your cells from your body going back into your body. These are mesenchymal stem cells, and again, they're bone marrow derived. So this slide kind of shows what to expect if you decide you want to have a stem cell procedure. It's actually a 3-step process. The analogy of the 3 steps is like planting seeds in your garden. So the first step is done with prolotherapy, which is, like I mentioned earlier, the grandfather of regenerative medicine. So what you'll get on that date is a injection with a solution we have on our shelf, which is Prolo, which is a dextrose-based solution. And what it does is it initiates an inflammatory response, which is like tilling the soil in the joint. The second day is the stem cell day. And what this slide is showing is that we get your stem cells from your bone marrow. And the bone we utilize is your pelvic bone, the largest bone in your body. It's very safe and very easy to get a needle onto that bone, and very safe and very easy to get a needle into the bone. We will numb up the entire area so you won't feel the needle going into the bone. And we also have ways of including laughing gas and medication to help make it easier for you if you are at all nervous about that part of the procedure. That being said, we have done several thousand of these in our practice, and it is very safe and very well tolerated. Once we get your bone marrow, we take it to our lab. Our lab technician will process it, prepare the stem cells, and that same day we will inject the stem cells into the area that we are treating. Again, it has to be done on the same day because those stem cells are alive, and we want to place them right back in when they are alive. The third step of a stem cell procedure is done with PRP, or platelet-rich plasma, and that's generally 2 days after the stem cell procedure. The reason we put platelets in after a stem cell procedure is they act like a fertilizer to the stem cells. So again, the analogy of the 3 steps is tilling the soil, step 1, planting the seed, step 2, fertilizing the seed, step 3. The first question is this safe? And especially when you're comparing this to surgery, it is extremely safe. Everything that we do is done guided using ultrasound and fluoroscopy. Everything we do is sterile. There's basically little to no risk with any of the procedures we do. Whereas if you're comparing it to surgery, there's significant risk for major problems happening, including death, heart attack, stroke, infection, nerve damage, blood clots, cancer, all of these serious complications, where these do not happen with the Regenexx procedure. Next, I'm going to talk about different body parts. I'm going to just focus on a couple of the main body parts that we treat, but again, we do treat the entire body for any orthopedic issue. I'm starting with the knee because that's the most common joint we treat for two reasons. Number one, it's the most common problem that people have out there, but more importantly, knees do great when it comes to stem cell procedures. Even people that have bone on bone, I need a knee replacement tomorrow, can come to our office, get a stem cell procedure, and expect to have a significant, about 66% improvement from their baseline with a stem cell procedure. So knees are home runs. We've done, a lot of knees with osteoarthritis for that reason, and 95% of our patients have not gone on to have a knee replacement. We can also treat torn ACLs and torn meniscus. Meniscal tears always go along with osteoarthritis, but we can treat them if they're by themselves with PRP. The ACL tears work very well. And here is a slide of a torn ACL. I'm pointing my arrow here showing where the ACL should look like a dark black line. And this is in fact what it does look like after a stem cell treatment. So ACL treatment is a very new and exciting area within our practice. We've done a number of these, especially for younger athletes. And as long as that sheath is intact, which you can see here, you can undergo a stem cell treatment and expect to have a full recovery for a torn ACL. Moving on, we also, the shoulder is probably the second most common area of the body that we treat. Rotator cuff problems are extremely common. And if they're small and minor tears or just partial thickness tears, we can treat those with PRP by itself. If they're larger tears or full thickness tears, a stem cell procedure can help heal a torn rotator cuff. And I do have a picture of one of those that I'll show you in a second. We also treat labral tears or a slap lesion, which are really common athletic injuries to the cartilage in the shoulder. And we also treat arthritis of the shoulder or tendonitis in the shoulder. So this slide shows an example of a rotator cuff tear right here where the arrow is. Pre-stem cell procedure and post-stem cell procedure, you can see that the rotator cuff has regrown. So that's an example of someone being healed with a stem cell procedure for a torn rotator cuff. The hip is the third most common area that we treat. Now, we do have to be a little bit more careful when evaluating hip patients, because if you do have severe end-stage arthritis of the hip, the stem cell procedure is not for you. However, if you don't have severe end-stage arthritis and you have just moderate arthritis or more mild arthritis, stem cell procedure can make a huge difference. For osteoarthritis of the hip. We also treat other conditions like avascular necrosis. And avascular necrosis is when part of the bone dies, and that does involve us sticking a needle down into the bone and actually drilling into the bone. 73% of Regenexx stem cell procedures have returned to sporting activities, and they've had great improvements for the right patient. So I'm not here to say that hips don't work. They work very well, but we have to be more careful in selecting who is right for a hip procedure. This is an example of a needle going into the bone for someone with avascular necrosis. The other main area of the body that we treat is the spine. We have been treating spine in our practice for more than 20 years. And in the past, we were doing all kind of traditional spinal injections with steroids and rhizotomies. And we've switched basically all of those procedures to regenerative procedures because it works so much better and leads to long-lasting permanent improvement for our patients. And this includes things like painful and herniated disc, facet-mediated pain, ligamentous pain, sacroiliac pain, spinal stenosis, and post-operative pain. So even if you've had prior surgery, you can still be a good candidate for a Regenexx spinal procedure. This is an example of an epidural injection. As I mentioned, we are now doing all of our epidural injections with platelets. Why? This is a reason why, because it lasts longer, it works better. Steroid injections may make you feel better, but by 3 months, they're basically worn off. Whereas a platelet injection will last months to years. And these can be repeated if you're still having ongoing problems. So again, these are a significantly better product that will last much longer than you can get with the traditional steroid injections. And believe me, we know that because we did thousands of steroid injections in the past, and we basically have moved away from doing the steroid injections to the platelet injections because of the significant benefit that you get with a platelet injection. So how does Regenexx compare to other clinics that are doing, quote, stem cell work? I say quote because, as this will show, this, most of these clinics are not actually injecting stem cells. Amniotic clinics, which are very popular and very common, whether they're using amniotic fluid or using cord blood from a pregnant woman, are selling this as a stem cell procedure. However, there are no live stem cells in the products that they are injecting. These have been studied by a number of different companies that have looked into whether or not these are real products, and there is no data to support any success. So as opposed to what we're putting in, which are real live stem cells that have the ability to actually make a difference. So very much buyer beware if you're considering doing an amniotic or cord blood treatment. These are also generally performed in a chiropractor's office. They're not done with guidance, meaning they have no idea of where they're actually sticking the needle, if it's actually in the correct location. They're often done by a PA or a nurse and not by a physician. And they can charge extremely high numbers for these procedures that basically do not do anything to help you. When you compare bone marrow to fat, there's two reasons why we're using bone marrow over fat. Number one is it's a superior product. And number two, the FDA has basically come out and said that you can't use fat anymore as a source of stem cells, because when you manipulate fat, you are actually turning it into a drug. So when you compare fat versus bone marrow, does fat have more stem cells than bone marrow? The answer is definitely no. Bone marrow has a lot more stem cells than fat. So that's the reason why we use bone marrow instead of fat. It's a better product and it's FDA compliant. There's been a lot of head-to-head research, and it heavily favors bone marrow over fat. Again, we're able to concentrate your stem cells to 20 times what you can get with a fat treatment. People also ask, are my stem cells too old? And the answer to that question is absolutely not. As I mentioned earlier, stem cells regenerate just like other blood cells. So the stem cells that we take from you will totally regenerate. So your stem cells that are right now in your body are anywhere from 1 to 3 months old. They're not your age. Your body, the ones that you were born with are not the ones that you still have now. So again, we've done many patients in their 80s. We've done patients in their 90s. We even did a 98-year-old gentleman with stem cells who had a very positive response. So what's the downside to all this? The downside is that the insurance, most insurance programs do not cover the actual procedures. What your insurance will cover is a consultation in our office, meaning the initial evaluation with me, with Dr. Lieber or Dr. Sally, all of your follow-up visits in our office, any diagnostic testing that we would order, which would include X-ray, MRI, any blood work, any bracing that we might order with the procedure, and physical therapy that we will order after the procedure. We do send all of our patients to therapy, and that is covered through your insurance. What traditional health insurance does not cover are the actual procedures themselves. So that's when you're actually coming in and getting the PRP, the platelet lysate, or the stem cell procedure. The cost is really dependent on what you decide to do. And there is a large range, and we would again discuss this with you when you came to our office, as opposed to having to help you make an informed decision. So in conclusion, Regenexx isn't magic pixie dust stem cells. It's advanced, precise, and safe interventional orthopedics. We've been doing this longer than anyone in the United States. We have more treatment options than anybody else. We publish more on our online registry, and we have more data than anybody else. And we use this data to help stack the deck in your favor. Again, we're constantly looking at all of our treatments to see how we can improve our outcomes, and that's what it's all about. So how do I get started? The answer to that is come see me in my office. Come see Dr. Lieber in our office. Come see Dr. Sally. When you come to see us, we will do a comprehensive history and physical examination. We will review your diagnostic testing. We will do a musculoskeletal ultrasound exam in the exam room. We will spend time with you and we will answer all of your questions. We will give you all of the options, both operative and non-operative, that you might be looking at, and we will give you an honest opinion. Again, the consultation is covered through your insurance. We take all different health insurances in our office. So bottom line is just call the office and schedule an appointment to see myself, Dr. Lieber, or Dr. Sally in one of our 5 locations, and we will be happy to see you. This is just a little slide showing that Regenexx also makes some supplements that are very helpful that we do recommend for our patients, and we have those available in our office. So again, the final step is to call the office, call our Regenexx call center. That can be reached at 412-963-6480 and make an appointment. So now I will end my slideshow and answer any questions that we may have. And I did get a couple of questions before. And again, I'm happy to answer these. I do once again want to apologize for the computer glitch tonight. As you can see, I'm not a young guy, and sometimes I make mistakes when it comes to technology. So let's answer some of these questions. First question I have is, can you do both knees at the same time? To answer that question, the answer is no. And the reason is, when we do a stem cell procedure, we can only get a certain amount of bone marrow safely at one time, which means a certain number of stem cells. If we take half of those and put them in one knee and take the other half and put them in the other knee, each knee is only getting a half a treatment. So what's better is to take all those stem cells, put them in one knee, your right knee, for example, have that knee get better, make it stronger, and then come back several months later and do your other knee. So we will do both knees, but we usually wait a minimum of 3 months. More often, it's like 6 months in between. So yes, we will treat both knees, but we don't do them both at the same time. Okay, look at other questions. I've had prior back surgery. Does that make me not a candidate? No. As I mentioned earlier, we treat people who have had prior surgery. Not all surgeries are the same. So not all outcomes are going to be the same after surgery. So we have to look at what type of surgery you have, but that is no way makes you not a candidate. So to answer that question is, yes, we treat post-operative patients. Really, that's throughout the body. So people, for instance, knees, a lot of people have had prior scope procedures. They've had their meniscus repaired or removed, and they're still a good candidate for a regenerative treatment down the road. So prior surgery is not contraindication. All right, just looking at next question. If I have a good result, how long should it last? That's a great question. We do have some data to help answer that. I've been doing this now for 10 years. People asked me that question 10 years ago, and I said, well, you'll let us know. Well, some of those patients are now coming back. What we have is really good 5-year data that shows that people who were better at 6 months were still good at a year, at 2 years, at 3 years, and now out to 5 years. We have several thousand patients with that 5-year data through Regenexx. So we know it's not just you're better at 6 months, you're better, and then you're right back to where you started from a year later. If that was the case, it probably wouldn't be worth doing. We don't have 10-year data yet, but we're hoping to get that 10-year data sometime soon. Next question. I had radiofrequency on my facets in September. I'm okay now, but it's wearing off. Am I a candidate? Yes, absolutely. A prior radiofrequency procedure does not in any way affect your ability to undergo a regenerative procedure. This is something that we have seen all the time. Most of our patients have had prior pain procedures like an RFA. Again, as I mentioned, I've done thousands of RFAs in the past. I've kind of abandoned those procedures for the most part because I have a better treatment to offer to you. As you know, RFAs wear off, generally after 9 to 12 months, whereas our treatment can lead to a long-lasting permanent improvement. So no, and there is no contraindication to having a treatment after an RFA. One more question here. And I think I already answered this. They said my stem cells are too old when I saw another clinic. Again, your stem cells are not too old. The stem cells that we take from you, the bone marrow concentrate, is something that your body has constantly regenerated. So these are not too old. As I mentioned, we did a 98-year-old gentleman in our practice, and he did great up until he died at 102. Any other questions before I sign off? Okay, I don't see anything else. So with that, I want to thank everybody. And if people weren't able to log on due to the technical problem I had earlier, we are recording this. So hopefully they can go and watch the recording and see this at another time. Thank you for joining me tonight. Good night.